In healthcare, clear and effective communication can save lives. But handover conversations can be rushed or unclear. That's where SBAR comes in. SBAR is a structured tool for effective communication. It ensures critical information is conveyed clearly, useful for urgent issues, and smooth handovers. All right, let's break down SBAR. Starting with S, situation. Get straight to the point. What is happening with the patient right now? State the patient's name, age, location, and immediate concern. Avoid unnecessary details. Focus on what is urgent. For example, "Hi, this is Nurse James from the surgical ward. I'm calling about Mrs. Green, a 72-year-old patient who has suddenly become short of breath." Next up, we have B, background. Now that you've stated the urgent situation, provide some essential context. What is the patient's medical history or reason for admission? Keep it brief, but include key details such as diagnoses, medications, or recent procedures. If it's an emergency, highlight what's most relevant to the situation at hand. For instance, you'd continue with, "Mrs. Green was admitted 3 days ago following hip surgery. She has a history of COPD and is on oxygen therapy." This gives the listener important information to understand the situation better. Now we get to the heart of the matter. A, assessment. This is where your clinical judgment comes in. What do you think is happening with the patient based on your observations? Use objective data to support your assessment, such as vital signs, symptoms the patient is experiencing, and relevant test results. It's important to describe any changes from the patient's baseline. Following our example, you might say, "Her oxygen saturation has dropped from 96% to 85%. Her breathing is labored, and her respiratory rate is 28. This clearly presents your assessment of the situation. Finally, we reach R, recommendation, the action part of SBA. R. Make a clear and actionable request. What do you need the other person to do next? Be specific. Do you need an immediate review, a change in treatment, or advice? Offer a solution or ask for guidance. Conclude with a clear recommendation. To make SBIR even more effective, follow these tips. Be clear and concise. Avoid unnecessary details. Stay calm and confident. This ensures your message is taken seriously. Use it consistently. The more you practice, the more natural it becomes. Using SBAR helps structure communication, making handovers faster, clearer, and more efficient. No more missing information or confusion. If you found this helpful, like and subscribe for more healthcare tips.